going to now be fortunate enough to have a presentation from Egbe from Anadach, for the Anadach group.
Thank you. And thank you so much for having me on. I'm really excited. And like you said, it was very interesting listening to some of the earlier presentations dealing with the older adult population. And I'm sure, and I suppose that, in about 2030, there's going to be, for the first time, there'll be more adults over 65 in the US than children. And this has sort of significant issues for older adults. And I think it's also important to note that older adults, mostly want to live in their home or in their sort of current retirement facilities. And so on this, during this conversation, I'm going to be looking at it basically from a health perspective, but because health in older adults is multifaceted, which I think several other speakers have mentioned earlier, I think it's important, that that's one of the key differences between healthcare in older adults than in other adults. And I think the folks from ARP had talked about the market and how big it's this issue, but I think we have a particular bump coming here as the 73 million individuals, including me, start to make the baby boomer generation. We will be changing what looks like. And so what does this mean? There's sort of a couple of issues sort of coming up. The population is aging, and usually often as you age, you tend to have more chronic conditions and sort of complex conditions. Maybe 3, 4, 5 conditions requiring multiple medications. And but even though often people do think that many older adults are frail, I think somebody mentioned that earlier, when you look at the numbers, maybe about 15% are high risk, and then 30% are probably sort of rising risk. And one of the things when you're trying to maintain costs, you're trying to reduce, people going into the high risk population, but there will be. And increasingly, there's sort of poor outcomes. And one of the results of having an aging population and a reduced younger population, results in the fact that you actually have reduced number of people who can care for the elderly, or the older adults. And that's not just because of the age, but in terms of geriatricians, doctors, nurses, but even sort of family carers, once you have more older people than younger people, and you can imagine that the numbers will be significant. And there's also, of course, the sort of rising costs and the fact that social or challenges of living can sort of get older adults into hospital. And so when you look at this, if you look at the older adult population, even though they're relatively, well, not that small, but this is the 85 and older, and this is 65 to 85. But yet, when you look at the cost of healthcare expenditure, this is what you see. But when you compare the US, here in the US, to other countries, look at how much more we spend per older adult, and the big change, because it's always said the US spends more than other folks, but when you look at it by age, the big change where US healthcare expenditure sort of really increases over other rich countries, it's really around that 50 to 60 mark. So, and I think this is sort of a very interesting thing to note. And when you talk about, so how do you make care more efficient and sort of more effective? And this sort of shows our medical expenditure, which is on the increase. So like I mentioned, there are relatively few geriatricians, required, and the pipeline is, really slow. And generally at this point, I think we have about 30% of the geriatricians we need, but the pipeline is really not increasing. So what can you do differently? Today we're talking about digital issues, and the colleagues from ARP had mentioned this, but older adults are also using smartphones, they're using internet sort of much more frequently, and the technology adoption is increasing. And so this allows, a couple of things. One is that what can happen to older adults, or how can they use phones themselves, self-care of them, outside the healthcare facility, that can help make sort of healthcare issues better, or things that providers or folks that work in this area can use. You all may have remembered this was a long time ago in 2020. There was a really bad pandemic, which disproportionately affected older adults, especially in older homes, older people's in homes, or those kind of care settings. But one of the things that happened was really this sort of acceleration of telemedicine, and people thought, okay, this is probably the solution, that telemedicine would really sort of revolutionize, older adult care, and they'll never have to go to hospital. But even this is just by 2021, and I think now it's probably down in the sort of 20%. So there is a role for sort of telemedicine, but probably not the sort of cure-all that people had thought or had hoped, in the early components of the pandemic. And so for this, I mean, when you look at what's available, or what apps or what technology is available for all the adults, several folks have spoken about different types today. And really, I mean, in this, which really focuses mostly on seniors at home, you probably have between 2 to 500 different sort of potential apps that works, and really sort of things, what can you do to actually, somebody had mentioned, people with cognitive decline. So for example, how can you make things better so that, for example, they continue to eat, so you do not have issues, related to nutrition that could even affect, their chronic illnesses like diabetes or hypertension, or what can you do to help support sort of independence at home, which appears to be many people's desires, and sort of wearables. One of the earlier speakers spoke about wearables. That is this part of health tech. In my view, it is, because you can use the information for things that can be actively used to manage patients, both older adults before their patients at home, but also can be better used. You have that information that can better be used in managing even their clinical conditions, either helping to segregate people into risk, or even making the hospital admissions even sort of more effective. And this are a couple of different examples of various technology-based innovation that could be helpful to people sort of directly and sort of outside the hospital, but can help them live more healthy lives that will reduce the demand, or hopefully the need, for sorts of complex care. Especially when older adults go to hospital, they tend not to do as well. And so as much as possible, you would like to manage people in their home settings and try and prevent admissions into hospitals. And of course, that's not always possible. And so I got into geriatric care because one of the things Anadach does is really we provide advice to management companies and CEOs. And I was an advisor to the CEO of 6M, a geriatrician who was really interested in sort of using the digital platform to see how you can improve care for the elderly. And in this sort of proof of concept, one of the areas, and they were sort of providing sort of different areas and dealing with the multi-stakeholder care you require to provide high quality care for people in their communities. And they were able to sort of digitize maybe 75% of it, and seemed quite well received. So at this point, 6M is now sort of rethinking the model. They're really focusing on the technology. They had an app which was available to both trained clinicians, qualified clinicians, but also to caregivers who could then be in sort of direct communication, you know, to the medical staff, but also patients. And that issue of sort of communications, because many older adults, especially who have chronic conditions, maybe 6 different conditions, you know, maybe using 6 to 10 medications, that whole idea of coordination and collaboration to ensure the best possible care is sort of critical. So I think this sort of shows, you know, when you're sort of aging at home, you know, requires a lot of supports. And so the whole idea really was, you know, how do you make that support sort of work around the person to be very sort of patient-centered. And as more people, I mean, want to age at home, I think the way we think about our healthcare system and how we pay for it really needs to take this move into account, especially because it may also be more cost effective than you know, than having patients in hospitals, which is the real sort of original design for delivering healthcare to people with multiple conditions. And so now, just to make sure that I have enough time for questions, you know, and of course, I mean, another speaker had talked earlier on the issue of using sort of artificial intelligence and, you know, in healthcare and in older adults, giving all the wearables, giving the information you get from different settings. You know, we think that is critical to sort of improving healthcare for the growing population, you know, of older adults, especially given the fact that there will be a shortage, and there is already a shortage of caregivers for this population. Thank you very much.